Hello guys, hope you're all okay. You're also enjoying my videos and you're also watching my differential diagnosis series. So as you know, I'm discussing about the differential diagnosis of the bone tumors. Today I'm going to discuss about the bone tumors, Lucent bone tumors, which grossly expand the medullary cavity. So these are of three types: those tumors which are malignant, those which are benign, and those which are non-neoplastic. So the benign tumor happens to be metastasis. Sometime it expand the medullary cavity. It happens to be osteosarcoma, fibrosarcoma, telangiectasis, osteosarcoma. So these are the malignant tumors which usually expand the medullary cavity and happens to be lucent. Certain benign tumor, like it include the simple bone cyst, or it include giant cells or inchondroma. These may cause the expansions of the medullary cavity. Beside this, certain non-neoplastic lesions are like fibrous dysplasia or hemophilic tumors or brown tumors of the hyperparathyroidism or hydatid. These may also expand the medullary cavity. For further detail, look for the next slide and find out how we can shape these differential diagnosis for the lesion which happens to be lucent, medullary, but with the expansion. Differential diagnosis for the lucent bone lesion which are grossly expansile may be due to malignant bone neoplasms, including metastasis, especially renal cell carcinoma and thyroids happens to be grossly expansile, while less commonly can be seen in melanoma and bronchus, breast, and few chromocytoma can also cause expansile lucent bone lesion. Plasmacytoma that can also cause grossly expansile medullary cavity with soft tissue extension and internal septation. In central chondrosarcoma, lymphoma of bone, and fibrosarcoma, when slow growing, may have this appearance. However, in the fast growing, it will not be like that, but in slow growing, this will cause expansile expansion of the medullary cavity. Telangiectatic osteosarcoma, although it's very rare, uncommon vascular variant that may mix aneurysmal bone cysts. So these malignant neoplasm causes lucent bone lesion which can grossly expand the medullary cavity. Lucent bone lesion with the grossly expansile characteristic can also be seen in different benign bone neoplasms like aneurysmal bone cyst. In the unfused metastasis or metaphases and epiphases following fusion of the growth plate, internal septa, fluid level can also be seen on CT and MRI in aneurysmal bone cyst with grossly expansile component. Joint cell tumor, typically subarticular after epiphyseal fusion, ill-defined endosteal margin with soft tissue extension and destroyed cortex. It can also be seen in enchondroma, ground glass appearance with internal calcification. So these three tumor can cause medullary expansion, and this will be appear as a lucent bone lesion. Some of non-neoplastic lesion also appears as lucent bone lesion and can grossly expand the medullary cavity, including fibrous dysplasia. The appearance of the fibrous dysplasia would be ground glass with internal calcification and modeling deformities of the affected bone. It can also be seen in hemophilic pseudotumors, especially in the iliac wing and lower limb bones. Soft tissue swelling will be there, and along with hemophilic arthropathy. Brown tumors of the parathyroidism will be having the same characteristic: solitary skeletal sign of the hyperparathyroidism, most commonly in the mandible and followed by the pelvis rib and fracture, usually unilocular. And hydatid can also cause grossly expansion of the medullary cavity.